Would you like to know how to use a TENS unit? TENS therapy is a commonly used pain relief method, but it can be confusing to use. Factors that contribute to TENS therapy's success include device settings, pad placement, and complementary treatments. Make sure to place the pads around the pain, not on top of it. Also make sure to use electrodes in even numbers. Safety precautions include being aware of side effects such as tingling, twitching muscles, skin irritation, nausea, and potential burn marks. TENS therapy should not be used by individuals with pacemakers, metal implants, spinal cord stimulators, or indwelling pumps or monitors. TENS therapy may be safe for cancer patients, but more research is needed. TENS units should not be used in or around water, while sleeping, or while driving or using heavy machinery. Electrodes should not be placed on open wounds, swollen or infected skin, cancerous lesions, irregular feeling skin, the head or face, the throat, both sides of the chest or trunk simultaneously, or directly on the spine. General protective measures include turning the device off before removing electrodes, not sharing pads, keeping the device out of reach of children, and following instructions. TENS devices can be used as often and as long as needed, with a recommended break of 10 minutes for every hour of use. Different TENS modes, such as normal, burst, and modulation, have different effects and are ideal for different pain types. TENS unit settings, such as pulse rate and width, can be customized for optimal pain relief. Pulse rate and width settings have different effects on the body, and higher frequencies may cause skin irritation. Pulse width, or duration, determines the strength of the stimulation, and should be set opposite to the pulse rate to avoid discomfort.